British Parliament condemns slow government response against COVID-19. Government officials engaged in groupthink, according to a British Parliament investigation, which delayed order for a national lockdown during the early stages of the COVID-19 epidemic, which proved expensive. The 151-page report from the House of Commons Science and Health Committees says Prime Minister Boris Johnson's cabinet took a slow and gradualist strategy in the early months of 2020 to control rather than fight the virus spread. This fatalistic approach, according to the joint investigation, allowed the virus to spread across the UK until it was ultimately abandoned as the National Health Service threatened to be overwhelmed by the fast increasing number of patients. On the other hand, the study noted a lack of data sharing across the federal, state, and municipal administrations. According to the MPs, the government's reaction to the epidemic was one of the most significant health failures in British history. Ex-Health Secretary Matt Hancock and former Prime Minister's Special Advisor Dominic Cummings, among others, spoke for hours in the final report. Beginning in December 2020, researchers compared the results of 11 million vaccinated individuals against an equivalent number of unvaccinated people. The research discovered that approximately 14 days after getting a second dosage of the Pfizer, Moderna, or AstraZeneca vaccinations, the chance of acquiring the coronavirus was decreased by 90%. The single-dose Johnson & Johnson vaccination was omitted from the research due to its authorization in France being considerably later. On average, individuals aged 50 to 75 were protected 92% of the time against the Delta variation, while those aged 75 and beyond were protected 84% of the time. Additionally, it states that the vaccinations maintained their high degree of efficacy throughout the 5-month trial period.